All right, Dr. Chidi Patrick, talk to us about the economic impacts of these eye conditions. When we talk about economic, we're talking about money here. So how would you say these conditions affect people's daily lives in terms of their socio-economic impacts?
Okay. You see, vision is so important that when it's absent, it hinders the ability to make money. So basically, it reduces productivity when you don't have vision. And then when you don't have at all, you can imagine there's nothing you can do about it. Although there are people without vision that can focus on other aspects of life. But basically, your life is now, half of your life is more like to channel your, is channeled to other areas.
Okay.
Now, some of the impacts include for children, hindrance, low academic performance. Then we have increase in the risk of accidents for drivers, and the overall quality of life is also affected. Take a look at somebody who has lost his vision. He can't see. I once had a patient who complained that he is old, he has lost his sight, he can't see his grandchildren, he can't see the color of the food he eats, he doesn't even know whether the person feeding him likes him.
So sad.
So that actually affects the lifestyle. Then for children, we've also discovered that it affects, it creates anxiety. There are some disorders that can come up as a result of loss of vision, for instance. Anxiety can come in, depression can come in. Some people live in pain. They are not always happy. So their quality of life generally is affected in everything they do.
Wow, Dr. Chidi, what you mentioned right now, it's such a pathetic situation. So in all of this now, are these conditions, eye conditions, are they prevented? Can they be prevented, basically? And how often should individuals go for eye checks?
Okay, great. These conditions greatly can be prevented. A statistic shows that 80 to 84% of visual problems are avoidable.
Wow.
Yes, they are avoidable. So how do we go about it? You need to go for regular eye exam at least once every year. That's the frequency.
Okay.
Because some of these conditions, they don't, they manifest over a long period of time, and the key to nipping them in the bud is early detection. So some of them are painless. Some of them, we call them the thief of sight. They don't manifest in any form. So the individuals of the victims don't know that they have this condition. So regular eye exam can help you a lot in detecting these conditions early. A healthy lifestyle is also very important. For instance, when you eat balanced diet, you can improve your vision. But on the other hand, when you smoke, you can inflict other conditions like cataract. Your lifestyle should be balanced. Then we talk about the treatment, which can also take the form of medication, surgery, or even corrective glasses in some cases. So most of these are actually preventable.
Wow, fantastic. I'm glad we have hope. We have hope for those who have eye conditions. All right, so Dr. Chidi Patrick, from what you have seen in your professional practice, as optometrist, are eye checks or examination covered under health insurance?
Yes. The answer is yes. So most health insurance cover routine eye examination, they cover treatment, they cover surgical procedures in some extreme cases. So the problem we have is most people are not aware of these packages. They can take advantage of it, and they will have their eyes examined.
Okay, so talking about those packages now, many people, they complain of high cost of high treatment. So, do you think having a high health insurance plan can give people that affordable access to high care and treatment for these conditions that we mentioned earlier on?
Of course, yes. You see, most health insurances come with different packages. It's just for you to present yourself to the clinic and have your eyes examined at first, which is the most important. When your condition is detected, the cure or the treatment will take its course. So health insurances are very good because they give everybody the chance to have affordable eye care.
Wow, wow, that's a good news. So, in case you're listening right now, you're wondering, how do I go about this with the economy? So you've heard it there. You got to subscribe to health insurance so you can always have your eye checked and, of course, treated as well. Okay, we're still health insurance today on radio, Lagos Traffic Radio 96.1 FM. All right, Dr. Patrick, it amazes you that some people, they try to, avoid going to the hospital for, medical checkup and all of that. They try to make use of what they call local remedies now. I heard some people use battery water, to put in their eyes for clearer vision, and all sorts of bizarre things. What do you have to say about, trying to seek for help locally?
Okay, I'll say it's advisable you don't go into all those kind of practices because you end up damaging your eyesight even further. The best result is to go to the nearest eye clinic and have your eyes examined for that condition. Some persons put acidic battery water, which is acidic most times, and you get burns, you get irritations, which could have been prevented. I hear of some mothers who put breast milk, for instance. Some who, blend organic substances, leaves, and co, and put directly into these eyes. Now, it's true that most of these things are natural, but they are in complex forms and they can damage the eyes. So the easiest path is to go to the nearest eye clinic, have your eyes examined and treated properly at even a very reduced cost, because the cost of maintaining a damaged eye is higher than preventing it in the first place.
Wow, well said. I just hope you can say that again for our listener right now. You are an expert in eye care, and so what advice do you have for the listeners in the area of maintaining good eye health?
Okay, I'll advise our listeners to prioritize the eye exams so that conditions can be detected early. Some of these conditions can actually damage the eye if they're not detected early enough. Then I'll also advise them to maintain a healthy lifestyle. Some of those things, like what we just said now, if you put local remedies or local concoctions or whatever sort into your eyes, you risk damaging them further. You seek professional help if you experience any vision problems, and then consider getting a health insurance policy. It will help you a lot. That's my advice for them.
Thank you very much. This is still health insurance today on radio. So as we round off this conversation, Dr. Patrick, we have some people who wear glasses, and so how often should they, have their eyes still checked? Perhaps should it, or is it a lifetime thing that you wear glasses all through your life? How regularly should they go for eye check as well?
When I get these questions, I marvel because we grow as humans, and change is constant. So when you have your eyeglasses today, you're going to grow, you're going to eat a lot of food, your body is going to go through a lot of changes. So what we advise is you go for your regular checks at least once every year. That way we can detect changes in your vision. And some of these changes, sometimes we want to train the eyes to get better, but the problem is most people won't go for checkup. You think that when you get your glasses, you wear them for life. The truth is, we train the eyes. We also expect the eyes to respond to the treatments that are given. So a regular check will prevent a lot of things,
All right, Dr. Patrick West, we'd like to appreciate you so much. Dr. Patrick, Dr. Chidi Patrick is an optometrist from Beraka High Clinic, Lagos. And he's also the acting public relations officer of the Nigerian Optometric Association, Lagos State Chapter. Thank you so much for sharing these useful tips on the topic, understanding common eye conditions. Also, we'd like to thank you, listener, for tuning in to today's Health Insurance Today on radio. And this is brought to you by A-Star Communications Limited. We hope you found our discussion very, very informative and helpful as well. Do you know that you can actually access affordable preventive care and treatment of eye conditions if you subscribe to a health insurance plan today? And if you would like to know how to subscribe to health insurance plans for you, your family, or organization, or you just want to know more about today's topic, please call or send a message to 09015388634. I say that again, 0901-538-8634. You can also email info@healthinsurancetoday.ng. info@healthinsurancetoday.ng. Don't forget to tune in next week for another fresh package. Same time for more information and insights on health insurance. Until then, stay healthy and stay informed.